If there's anything that keeps life moving forward, it's change. I look at where I've been, who I married, how I've always kept growing. And it seems like the changes I've made have just made me better.
If you've been thinking about Medicare, it's time to talk to Aetna. We'll give you a range of Medicare Advantage plans and offer help, so you can decide which coverage works best. You'll pay low or no plan premiums, qualify without a physical or a review of your health history, and enjoy coverage that travels when you do.
I've got a long way to go, and I'm ready.
Let's find a plan that works for you. To learn more or enroll, call 1-800-238-6248 today or visit aetnamedicare.com.
Welcome back. Well, as I mentioned at the top of the news, you have till December 7th, and that is your last day for open enrollment for the 2014 Medicare programs and plans. And today we have on two gentlemen that can help you out with that. With Aetna, we have Gary Culp, you're the head of Aetna Medicare, and Chris Corso, you are a licensed sales representative with Aetna. Nice to see you today.
Great
and
to see
it's
you
not
too.
that
Good
much
to see you.
longer that people have to go. And this is the time to, if they haven't figured it out by now, they need to start calling the right people and asking questions, because there's a lot of different opportunities out there, a lot of different plans, and to wade through all of them sometimes can be a little bit difficult.
It can be. It's a time that everyone needs to spend just to take a few moments, take a look at their current plan. We've talked about this before. It's not just today, it's thinking about tomorrow. So
Right.
what might I need? Is there a change in my doctor? Is there a change in maybe the medication I'm taking? So my needs today may change over time in terms of what I need. And looking at that each year and determining what the next year benefit package might be or what plan you need to be with is a good idea.
Yeah, and understanding how Medicare actually works can be a little bit confusing. And I think that all the different types of insurance that are out there, it's just basic insurance for people like me can be daunting. The different packages, let's say, that we're offered here. But when you get to that Medicare point, there's even more packages, and even within Aetna, there's several different options. There are.
Absolutely. You have Medicare supplement plans, you have Medicare Advantage plans, you have prescription drug plans. So yeah, there's a lot of different options out there. And I think on the screen what we're looking at here a little bit is Aetna's Medicare Advantage plan. So even Aetna has two options for Medicare Advantage, which is really unique. So Aetna has created a new value plan for 2014, which is open just to Orange County residents that are using Orange County doctors as their primary care doctor. The plan has a zero premium, zero copay for doctor visits, for specialist visits, for hospital. And the worst case scenario for medical is a $2,000 out-of-pocket maximum, which is actually a pretty big deal when it comes to a senior looking at what their insurance can cost throughout the year. That's the maximum that they would pay.
Yeah, looking at these two plans here, the select, it might be hard to see it on screen there, but you have the select plan, which is an HMO type of plan, and then the value plan. And what are the different benefits of each? You offer different plans here. They both start out with a zero premium that I can see, and the in-network is zero. And then as you go down, there's a difference in the out-of-pocket. So what are the differences between the two plans, and what would make one person choose one over the other, and the different advantages of the two?
It's a great question. I think the thing to look at for most people when they're looking at coverage is what it is that they're likely going to spend in the next year. And I would say that the value plan is probably the one that brings the best value to the market. This one offers the $2,000 out-of-pocket maximum, which basically says that at a maximum, you are never going to spend more than $2,000 a year with this particular plan for those covered benefits. And the other thing that's nice is for your routine services like your doctor's visits and your specialty visits, there's no copay there either. So it provides access to the doctors without having to share anything, as Chris had said. The nice thing is from a network perspective, Aetna offers a very broad network, even here in Orange County. So looking at these plans in Orange County, we're contracted with Monarch, we have Saddleback Hospital, we're contracted with St. Joseph Health, including the hospital systems with Mission, St. Joseph, St. Jude. There's a multitude of different options and solutions in this particular market. Prospect Medical Group is also another one that's contracted with Aetna. So we give a lot of different options here. Another thing that's really good about our network and our benefit and our product is that Aetna offers what's known as Travel Advantage. And Travel Advantage will allow our members to select a network that's part of Aetna and actually go into that network for up to a year. And the way that this works is, let's just say that I have two homes. Maybe I have a home here in Laguna Hills, and I have a home maybe that's in Seattle, or maybe it's in Florida, or maybe it's in Phoenix. Let's just say it's in Phoenix. I can actually select an Aetna network in Phoenix and move my benefits there for up to a year. So if I have a second home, or if I have children or grandkids or someone that I like to go and visit, my benefits are portable within an Aetna network. And all I have to do is pick up the phone and call our member service and let them know which Aetna network I'm going to and what's the time period that I'm going to be there. And the nice thing is these benefits go with them. So they don't take on the benefits of that particular market they're going to. Which could be different. These benefits go with them, which are some of the richest in the nation.
Yeah, we often hear that Orange County, particularly South Orange County,
that's right,
has some of the best different programs out there of anyone in the country. Moving on to the next slide here, and it's something that you've talked about before, is, and I think in general over the years what has changed in all these different types of plans that are out there, and with just the outlook in general, is healthier living, what you might call wellness, preventative care, and things like that. And of course, Aetna has certainly been a part of that for quite a while. And here, just going down the list here from the smartphone application and things like that, which I actually have because we have Aetna here. I'm not on Aetna Medicare, of course, but I have that. Case managers and resources to help you out through different things. And this is something that Aetna really has strived for.
Absolutely. So nurse case managers to help coordinate your care. So if you're diabetic or you have high blood pressure or high cholesterol, Aetna has nurse case managers that will reach out to our members and work with them and their doctor to try and help lower cholesterol, to help lower high blood pressure. A lot of our members will receive a free health blood pressure cuff to help manage their own blood pressure so they can take it themselves. Some of the other things that Aetna has is, vision discounts, hearing discounts. There's a gym membership. There's optional dental programs. So it's a pretty well-rounded package that Aetna has this year for 2014.
Yeah, and I think that's important because so many people here are, have an active lifestyle, and the fact that they can get other benefits through one of these plans is, I think it's important. And people are looking more and more towards preventative care rather than just waiting for something to happen, being active in your health. Now, these are all the different medical groups that you're with. Obviously, you're with all the ones in this area, the large ones, and people, they choose. It kind of explain a little bit because people might not be familiar, especially when you're on Medicare. It might be a little bit different. When you're not on Medicare, yes, you go through a medical group and all that to pick out your doctors within the area. But maybe you could kind of explain the difference between you got on your Medicare, you're with Aetna, you've got one of your programs there, and then the medical group.
Sure. So first of all, this is a good list of the major medical groups and systems that we are contracted with in Orange County, but by no means is this the entire list. We have a very extensive network, not only in this particular geography, but nationally, kind of back to the Travel Advantage. But to answer the question around kind of how does a medical group or the system work, it's really nice because as a member, you have the opportunity to select who's going to kind of help navigate you through the healthcare system. And typically we call those primary care
Right.
doctors. And once you select your primary care doctor, that primary care doctor is affiliated or associated with a medical group. So take Monarch, for example. The primary care doctor might be affiliated with Monarch. They have a group of specialists that they're working with. So if you ever need a certain specialty care, they can help direct you to the right specialist for that care. They're also affiliated with a specific group of hospitals or hospital, depending on the actual medical group, and they'll help you get connected to the hospital if that's ever needed. What's really nice about working with this managed care or medical group type of model is that you're not set out there alone to navigate yourself. You've got tools, resources, and help. So not just Aetna, like we've talked about with the Smart app or our customer service that can help via phone, but also on online tools, but also you have the medical group behind you helping you in terms of navigating the healthcare system. I don't think there's any American that wouldn't say that healthcare can be complex. The reality is that when something's complex, trying to find someone or something to help you is the right thing to do. So in the case of a medical group, this is another solution to help you navigate a complex system, because you can pick your primary care doctor, they can help in terms of navigating the system, direct you to specialty care, ancillary services, hospital, whatever the care might need.
Yeah,
Yeah.
and it can be a little bit confusing because you have at the top somebody like Aetna, and then you have sort of the HMO or the management like Monarch or Memorial Care or something like that, and then you have a medical group kind of below that. You can choose, you make your choice as
That's
you
right.
go down. Open enrollment, as I said, it goes to December 7th. What happens if someone misses that? Is there a chance for them to change? Maybe or let's say they're on a plan right now, they've had it for a year. They either like it or maybe they just kind of miss that date. Do they stick with that plan? Does that just keep going forward? Do they have to do anything?
No, they stick with that plan. They'll be on that plan moving forward. So if the senior doesn't make any changes, they will remain on that plan into the new year. So that's something that's good. If they're liking the plan that they're currently on now, definitely, they don't have to go out and make a change. If they don't make a change, they'll continue with that same plan. Now, somebody that's on maybe Aetna, how we showed the two plans earlier, we have two options. So it's something to look into for our Aetna members on which plan maybe they want within Aetna, and they still need to look at that as well.
Right, yeah.
So people that are maybe on our select plan might want to move to that value plan for 2014. So that's something that I can assist them with and help them as well. And all they need to do is call me, but they have to do it before December 7th.
Yeah, we
Believe it
have
or
the
not.
number on the screen, and 949-742-0302. And yeah, even with your own plans, there's little changes every year. So it's good that everybody looks at them, the different, what they call formularies and things like that, change through every single year, as everyone does. So it's always a good idea to give you a call. And even if you're really happy with one of your Aetna plans, to call and say, hey, I see you got this other plan. What are the differences between the two? This is what I like about my plan right now. Here's a couple things maybe I don't like, or maybe I'd like to see about the other plan if that offers. And it's a good thing to do.
Absolutely, definitely.
All right, it's good to have you both on. And again, December 7th, that is your date for open enrollment. Is that December 7th by 5 p.m. like they always say, or by the end, it has to be in by midnight? Or?
It has to be in by midnight.
Okay, all right, very good. Nice to have you on. I wish you both
Great to
a
have
great
you, to
Thanksgiving.
see you too, and happy Thanksgiving to you also.
All right, take care.
Thanks.
We'll be back in just a moment.
If there's anything that keeps life moving forward, it's change. I look at where I've been, who I married, how I've always kept growing, And it seems like the changes I've made have just made me better.
If you've been thinking about Medicare, it's time to talk to Aetna. We'll give you a range of Medicare Advantage plans and offer help, so you can decide which coverage works best. You'll pay low or no plan premiums, qualify without a physical or review of your health history, and enjoy coverage that travels when you do.
I've got a long way to go, and I'm ready.
Let's find a plan that works for you. To learn more or enroll, call 1-800-238-6248 today or visit aetnamedicare.com.